Good Saturday morning to everybody, and welcome to HyperFit MD radio show, where age management is always our focus. Along with Dr. Charles and Francesca Guglin, I'm Gary Byron. Hey, folks. Hey. How are you?
Good. Yeah, good.
Boy, it seems like forever since I've seen you. How's your week?
It's good. We were away last week. We went to Vermont for a well-needed vacation and had a really good time. Went swimming and kayaking and all that other stuff, and then right back to work, man. And you know what it's like when you go away for a week. The stack of things that you have to do is enormous.
Man, it is always bittersweet. Well, it recharges your batteries. Where as much as I was looking forward to going on vacation, I would look forward to, coming back to work and getting, but because I'm recharged. But then when I see the stack of papers or phone messages and emails, it's like, was it worth it? You know,
it lets the air right out of you. You just go.
And then if you take it with you, you get yelled at.
Right.
It's like, I thought this is a vacation.
Right.
You're not on vacation. I know you can't win either way, right? So we talk. Listen, folks, we talk a lot about age management on this show, and we've covered a lot of bases for those of you who have joined us. Maybe from the beginning. We appreciate that. If you've joined us at some point along the way, there's always topics that we go back and cover again. There's a show, that I want to do today, and maybe we'll kind of do a part 2 next week covering, women's sexual health. I figured today, though, we would cover men's sexual health.
Sure.
Okay. Well, let's start with something very elementary then. Mm-hmm. What are we referring to when we say men's sexual health? Let's just start very simple.
Sexual health is, first of all, let me say that we're going to be using some words there that may be uncomfortable for people because we're going to use anatomic words and stuff like that, which maybe some people don't like. But it refers to the state of well-being that lets a man engage in and fully participate and enjoy a sexual encounter, sexual activity. Simple as that, It also refers to things that we're not going to talk about today, like STDs and HIV and sexually transmitted diseases and things like that. That's not what I'm talking about at this particular point. What I'm really talking about is the kind of age-related sexual dysfunction that we see in men that comes from a host of different issues.
So what would you say then are the most important aspects of sexual health that you work with in your practice, let's say?
Erectile dysfunction, which is something that comes to mind obviously right away, right? Libido, one of the biggest problems that we hear about more with women than with men, actually. But with men, is a drop in libido as they get older, which to a certain degree can go hand in hand with erectile dysfunction. Another thing that we deal with is premature ejaculation, which is a problem really of younger men for the most part. We deal with that occasionally. I don't see that very often. Premature ejaculation, delayed ejaculation, also a malady that occurs to older men frequently is the word for it is anorgasmia, just an inability to orgasm at all, which is another problem.
What causes that?
Lack of stimulation. If a guy has had some kind of surgical procedure that makes things a little bit numb down there, medications, SSRIs are notorious for causing anorgasmia in men. Some antihypertensives have caused the same problem. Usually, 90% of the time when that happens in a man, it has to do with, it's usually drug related. Yeah.
I've heard over the years that your largest sex organ is your mind.
Absolutely.
So having said that, is it usually mind over matter?
No, I think a more accurate description would be that it's kind of a mind plus matter. They're true related, very deeply related in that regard. But yeah, I mean, we're going to talk about this probably probably more with women than with men, but relationship issues play a large role. If a man has had difficulty with erections once or twice in his lifetime, and it starts to achieve a pattern, that really gets into his head. That's a really tough problem.
So let's talk about that for a moment, and then I want to kind of switch over to a word that you had just mentioned a moment ago, and that's libido. But I'll get to that in a moment. There can be a lot of things, though, that can contribute to lack of erection, right? I mean, the first thing that people think of is age, which hence the reason why there's all these erectile dysfunction medications that are on the market today.
Yeah.
But there are people in their 20s and 30s that can suffer from periodical, problems with erectile dysfunction. You know, would a contributing factor be stress? I'm just trying to think. I'm trying to think of the temporary ones because, as you said, I mean, it's not all for people who are 70 years of age and older, and they just pop a little blue pill, and you'll be fine. I do know of someone who's in his how old is he right now? He's probably in his early 30s, but in his late 20s, a few years ago, he was having issues, and he thought something was so wrong with him. And I'm going to go see a doctor. I'm going to get on Viagra. And I'm like, what do you have? Believe me, you probably don't have these issues. You have other things going on in your life. And I go, in fact, I know you do. Can that seep into, and here I am, I'm no doctor, and I'm not diagnosing, I'm trying to tell him, I'm trying to ease his pain here, his mental pain going, and his concern. I'm like, it's probably seeping in. Your mind is elsewhere. I'm just trying to help the guy out. Is there any truth to that advice or that I was offering him, or to the suggestions that I was offering? Could it be all the stress that he was under in his job, that professionally, that have seeped into the reason why he couldn't have and maintain an erection with his girlfriend? Or?
Oh, absolutely. Yeah, absolutely. Stress is a huge factor when it comes to this kind of thing. Overwhelming stress leads to high levels of serum cortisol. High levels of serum cortisol can be an erection killer. High levels of stress can decrease a person's serum testosterone levels transiently, can be a real problem with erection. But mostly it's just when you're under stress, your head is elsewhere. It takes a certain level of concentration to have successful intimacy with another human being, and if your head is someplace else, you're going to fail, and then it's in your head for a good long time,
Yeah, and he works in
especially when you're 28. Yeah.
Well, yeah, he works in finance, and he was going through a lot of stressful times in his job. Is it safe, and this and that, and he goes, well, I don't know what's wrong with me, and I said, I wouldn't worry about it. Your age, you have age on your side. If you were, if you added 40 years to your life right now, I said, it might be something else. Sure. I said, so you don't want to head over to that little blue pill so early in life, because when you need it, you'll have already built up this, tolerance to it, right?
There's a tolerance that comes with using that pill.
Sure, if you start too early, and then after a few months or whatever it was, he was back to normal. Like I remember seeing him, thereafter, and he's saying, it must have been stress related. But it's hard to imagine that your mind works that way, where you would allow stresses from your professional life to seep into your personal life when you're trying to perform, I guess, for lack of a better term here. Yeah.
Well, it's a neurovascular event. It's your brain, the initial stimulation that comes with sexual desire or arousal comes from your eyes, your nose, your ears, hearing something that you want to hear, so on and so forth, those kinds of things. It starts with your brain, just like you said.
I would almost think that it fed itself, because then he obsessed over it. Like, why can't I? What's wrong with me? And then it just got worse.
That's what I meant when I said it gets in your head after a while, and then it's a real problem. Yeah.
All right, so a moment ago, you were talking about libido.
Sure.
So let's define libido right now.
Libido is the desire to have sex. It's typically not a huge. Well, I don't want to say that. I was going to say it's typically not a huge problem for men. It's not typically a huge problem for younger men. But libido is the desire and the just the desire to be sexually active, the desire to have sex.
All right. Well, then I don't know what. There's got to be things that can affect your libido. Then.
Sure. First of all, things that you were talking you touched on before: stress, depression is a huge problem with libido. Certain medications, and this goes to erectile dysfunction also. There's certain medications that can create problems with erections, especially SSRIs, antidepressants. There are, believe it or not, many of those antacid medicines, proton pump inhibitors. If you take those every day, they can lead to problems with erectile dysfunction. Antihypertensives, many of them you can have a problem with that. But I think the younger a person is having these problems, it's really more of an emotional issue, maybe depression, maybe somebody who's depressed and being treated pharmaceutically for depression. It can be a real problem under those in that regard. But when I talk about this, I'm talking about libido and erectile dysfunction, actually. But any of these things can just kill your libido. They're all libido killers. And in older men, as your testosterone levels drop off, that's one of the first things that happens.
So there's a link. There's a link between erectile dysfunction and low or lack of libido.
Yes, absolutely. Absolutely.
So this low libido or lack of libido, is it treatable?
Interesting. Oxytocin, which is the love hormone, compounding pharmacies, you can get oxytocin at compounding pharmacies, and it has a subtle effect with libido. Some patients will prescribe sublingual oxytocin, and it can, if they're in the right situation, so on and so forth, they can enhance libido. Libido is very much hormonally driven, especially in women. So you can actually turn somebody's libido back on by optimizing their testosterone levels. In this particular case, we're talking about post-andropausal men. And a lot of young guys who, for instance, I have a subset of patients in my practice who abused anabolic steroids at some point in their lives. And those guys have a lot of problems with libido and erectile dysfunction. Which the reason being because they fried their testicles and they don't make any testosterone.
Yeah, I've heard about that.
Yeah.
Sorry, erectile dysfunction. You mentioned this.
Yeah.
We talked about it a couple of times here already this morning. Yeah. Let's go look at definition. We all have an idea of what erectile dysfunction is, but define it as medically speaking.
Okay, it goes from a person who achieves erection very successfully, but cannot maintain it to the point where they can finish. It can be a situation where under certain circumstances you are having problems with erection. In other words, the stress stuff that we were talking about, those kinds of things, your young friend, that kind of thing. It can be a transient problem. To all the way to men who we see in our practice fairly frequently who haven't had erection in 5 or 10 years. Some of these guys, diabetes is a huge problem because diabetes wreaks havoc with the microcirculation in the penis. Prostate surgery, men who have had prostate surgery for prostate cancer, those guys, it's a really rough haul for them. Yeah,
there's a lot of different things that can affect.
Yeah, but anyway, erectile dysfunction all goes to one of the first things questions I ask people. First of all, you take a medical history, right? What meds are you on? Have you had problems with this before? Is this a new problem for you? How long has this been going on? Right down to, do you wake up with an erection? It's a very common thing for men to wake up in the morning with an erection.
Why? Because you have to urinate?
Probably, because you have to urinate,
Yeah.
and there's a certain level of stimulus there. And that's really a key question. There are several different kinds of questionnaires that you use in this field that you give to men, and one of the questions that is ubiquitous on those questionnaires is whether or not you have morning erections. So even guys, that's a very key question, because if a guy does not even having morning erections, then he definitely needs treatment of some kind.
I'm just trying to think what could cause a flaccid penis. When if you are with your significant other and you're hot and heavy,
Yeah.
and you're without taking any medication, without taking any of the blue pills, is it all mind? Is it strictly No.
No, it's always a combination. It's like everything else in life. It's a mind matter thing. As we get older, forget about the hormonal aspect of it because we can talk about that ad nauseum. But as we get older, cardiovascular disease. If you have coronary artery plaque, then you've got plaque in the vessels that lead to your penis, the pudendal arteries, which are the arteries that supply blood supply to the penis. If you've got plaque there, or the microcirculation of the penis suffers for some reason, like we talked about diabetes, it's a big problem in adult onset diabetics, erectile dysfunction. There's lots of different things that it's a multifactorial event to have an erection, and therefore it's a multifactorial issue, the lack of one.
I'm just trying to think of all the different things that could affect erectile dysfunction.
Well, all right. So we've touched on pretty much all of them. Cognitive issues, number one.
Sure.
Okay, stress, especially in younger men. Medication. There's many medications that lead to this problem. Testosterone, hormonal withdrawal, let's say, hormonal andropause, hormonal withdrawal. Other diseases, cardiovascular disease. We talked about diabetes. Parkinson's disease is it's one of the first symptoms of Parkinson's disease is erectile dysfunction. So is autoimmune disorders like fibromyalgia and those kinds of things. If pain is a significant part of your life on a daily basis, on a minute-to-minute basis, it's very difficult to, from a libido standpoint, that's an issue. If you're in pain all the time, okay, so that can contribute to erectile dysfunction as well. I mean, the contributors are legion, and you have to go through all of them to try to figure out what's going on and create a plan for somebody. You were going to say something.
I was just going to say inflammation.
Yeah.
Inflammation causes.
Yeah, just generalized systemic inflammation can be a real problem. Yeah.
Well, and treatments for erectile dysfunction. I mean, is it really just the little blue pill? Is that what it is? Or
well, you can skip to that.
There's things that there's preventative measures then.
Sure. I mean, if a guy is 250, a guy is 5'6" and is 250 pounds, and 8 of those pounds of belly fat, and he's got insulin resistance, and he's got he's got metabolic syndrome, he's got coronary artery disease, he's taken 5 different medications for all of those problems. You can, if you want to go for a grassroots approach to it, help a guy lose all that fat, help him get off of those medications. So if you really want to do the work, you can ameliorate half of the problems that can cause erectile dysfunction by doing the work of getting healthy. Don't forget that health plays a huge role here. Very seldom do you see, a jacked 50-year-old with no body fat who works out 5 times a week, eats very cleanly in the kitchen. Most of those guys have a very active sex life and don't really have much in the way of issues with erectile dysfunction until the testosterone levels drop off, and then we fix it with testosterone.
Folks, you are listening to HyperFit MD radio show, where age management is always the center of attention, along with Dr. Charles and Francesca Guglin. I'm Gary Byron. Today, talking a lot about men's sexual health with Dr. Guglin and how it relates specifically to age management. And of course, we get to a certain age. And I guess I say that stereotypically because although I gave an example of somebody that I know personally. At the time, he was in his late 20s, having some problems with erectile dysfunction that turned out to be an incredible amount of stress. And I remember him telling me prior to that, oh my goodness, Gary, you wouldn't believe the stress I'm under. And he's like, it might be affecting my, but it's more common, I guess, in people from the age of 65, 70?
45 on.
Oh, 45 on.
Sure, yeah, absolutely. And, what you talked about, the story that you told, is very unusual. Men don't typically talk about this stuff with their friends, It's not something that is part of the conversation to a very large degree because, it's the essence of our manhood, if you want to use that word, is the ability to have an erection. And so it's not something that's part of the conversation, and I think that's part of the problem,
Sure. Well, actually, the topic, how the topic came up was there was a time where in my life, I went like a couple of months without having sex at all because I was in campaigning. I was in the thick of a campaign, and I was morning, noon, and night. And I was talking with a friend of a friend. He's more of an acquaintance than a friend, but he's a nice guy. And he was talking about the rigors of a campaign, and I'm like, oh, you have no idea. You have to live, you eat, breathe, sleep, all this campaign. And he's like, well, and take it into the bedroom with you. I go, it's not even that. You put that on hold for, especially the final 2 months of it. Yeah. And then because I revealed something about myself, he was compelled. I don't know why. He took it upon himself to tell me. He goes, well, maybe I have a stressful job just like you, And I'm like, well, really? I go, what's, he's telling me about, what he's in charge of. Mm-hmm. And I thought to myself, you're at such a young age. And I remember just my late 20s, I go on all day and all night. And he goes, well, it was like that. He says, but I go, it could be the stress of your job. Mm. And he's like, well, maybe you think. And he really thought that there was something wrong with him. Mm-hmm. And I said, no, I'm no doctor. I can't diagnose you. I don't think so. But from what you're telling me, I would think that's what it is. So he more or less confided in me. Mm-hmm. And I'm trying to put him at ease and say, no, it's nothing wrong. Really, you're too young.
Are you going to talk about treatments like Gainswave and P-shots?
Yeah, we should talk about treatment at some point.
Yeah, I would love for you to talk about treatments.
First treatment is to get a full medical history and take a look at somebody. Make sure, try to assess the reasons for the erectile dysfunction, things that you can fix before you approach it from a procedural standpoint. Many times, now, testosterone is not a treatment for erectile dysfunction, but optimizing a person's serum testosterone, a man's serum, well, when we talk about women, we're going to talk about testosterone also, but if you optimize a man's testosterone levels, it sets the stage for success when you're treating erectile dysfunction. And many guys, it comes right back as soon as you optimize their testosterone levels. But there are procedural aspects to treatment for erectile dysfunction as well. One of the things that we use in our practice is what's called shockwave therapy. It's a kind of a misnomer. There's no shocks involved, but it is a procedure that where you use a small hand piece that is. It's a terrible analogy, but it's the only analogy I can use. It's much like a very small jackhammer. You apply this, I know. You apply this to the penis and the erectile tissue. There's 4 columns of erectile tissue in the male penis. There's 2 in the penis, and there's 2 at the base of the scrotum, and also the blood supply. So the whole idea of this particular treatment is through minor injury, and there's no bruising, there's no bleeding, there's nothing like that. But through minor injury, you are initiating the healing cascade. Phase 1 is platelet deposition in that area. Phase 2 is always collagen deposition, and so on and so forth. And phase 3 of healing is always neovascularization or new blood supply to the area. So the protocol is 6 treatments over 6 weeks, along with different things that you have to do. You have to take a nitric oxide preparation. Nitric oxide is a very potent vasodilator. It dilates the blood vessels. And it's a fairly successful treatment, with the exception of full-blown, long-term men with type 2 diabetes or type 1 diabetes. And it's kind of difficult. You don't get much in the way of results with guys who've had prostate surgery for prostate cancer, because that surgery pretty much damages the nerve supply to this area, so that it's very difficult to achieve that neurovascular connection to get a good erection. We also do what are called P-shots. It's actually a trade name. It's actually a, it doesn't matter. I'm not supposed to use that word, but a P-shot is, it's where we take your blood, take about 60 cc's of your blood, spin it several times, and what we wind up with about 6 cc's of pure platelets. And then you topically numb the penis, and you inject those platelets directly into the erectile tissue of the penis, and it initiates that same cascade. You have platelets in there that start call down stem cells and white cells. There's an inflammatory response that occurs, and the end of that response, which takes 4 to 6 weeks altogether, you wind up getting better erections because you've achieved ingrowth of new blood supply to the area. So P-shots actually work fairly well too.
I was just going to say that the shockwave therapy is known as Gainswave therapy.
Well, Gainswave is a marketing concern that they've put their name on it, sort of like Kleenex and tissues,
Yeah.
So So if you look up GainsWave,
It's the same.
yeah, it's a marketing company, but they've really adopted this.
Because I would imagine that there's some individuals perhaps that would not want to go the pharmaceutical way.
Yeah, I mean, look, what are the symptoms of taking Viagra? You know, a lot of guys, they complain about it. It works, but you get a stuffy nose from it. You get facial flushing. It's a very potent vasodilator. So it dilates the blood vessels in your nasal pharynx. So you get like a stuffy nose from it. You get kind of facial flushing from it. There is an attenuation of response over time. If you use it a lot, you need to use more and more of it, that kind of thing. And there's the whole wait thing, take it, you wait 40 minutes, and then by that time, she's gone to bed. Or you've already eaten a jar of Ben and Jerry's or something. You're just ready, you're done. Tadalafil, we shouldn't probably be using brand names. Sildenafil is Viagra. Tadalafil is Cialis. Tadalafil actually is good on a couple of
Really quick.
planes because it has a 36-hour half-life, number one. And number two, again, it's a very potent vasodilator. It's beginning to look like tadalafil may also be a treatment for hypertension. So there is some associative studies that show that men who take tadalafil long-term have a lower incidence of cardiovascular events.
This is only part one. We're talking about sexual health today, concentrating more on men. Next week, we'll talk about female sexual health. If you'd like to get in touch with Dr. Charles Guglin, it's very easy. All you need to do is shoot him an email. It's cguglinmd@hyperfitmdamc.com. Also, check out the website, hyperfitmd.com. It's that easy, hyperfitmd.com. They're located at 88 Noble Avenue, Suite 105 down in Milford. And their phone number, very easy to remember. Write this down, although you'll memorize it really quick. Area code 203-890-9777. That's right, 203-890-9777. For Dr. Charles and Francesca Guglin, I'm Gary Byron. Thank you so much for listening to HyperFit MD radio show. Until next Saturday morning, have a good one, everyone.